Colon cancer represents a major public health issue due to its high frequency and significant impact on the population. It can be sporadic, accounting for about 80% of cases, or hereditary, which represent the remaining 20%. Sporadic cancers occurs in isolation without any obvious genetic or hereditary cause. In other words, it develops randomly, usually due to environmental or lifestyle factors. This cancer most often arises from precancerous lesions, known as the adenoma-carcinoma sequence. This means that a benign tumor, such as adenomatous polyp, can gradually evolve into invasive cancer. This progression highlights the importance of early screening to intervene before these lesions become malignant. The diagnosis involves several complementary steps. First, clinical examination helps identify suggestive signs such as persistent digestive disorders, abdominal pain, or bleeding in the stool. Then, endoscopic examination such as colonoscopy, which play a huge role by allowing direct visualization of the colon and the detection of possible abnormalities. During this procedure, biopsies can be performed for histological analysis, which confirms the presence of cancer cells. The primary treatment for colon cancer is surgery. It involves removing the affected part of the colon along with the neighboring lymph nodes to reduce the risk of disease spread. Other therapeutic approaches such as chemotherapy may be considered, depending on the extent of the cancer and the patient's overall condition. The prognosis of colon cancer largely depends on how early it is diagnosed. The earlier the disease is detected, the higher the chances of recovery. This underscores the importance of raising awareness about the benefits of regular screening, especially for individuals with risk factors such as family history or something else. Colon cancer is a widespread disease that holds a significant place in terms of frequency and mortality. Regarding age, this type of cancer is relatively rare before the age of 45. However, its incidence increases significantly with age, peaking around an average age of 70 years old. As for gender distribution, the sex ratio is balanced, with similar incidence rates in men and women. This means that both sexes are affected equally, although specific risk factors may differ slightly between men and women. The risk factors for colon cancer can be characterized based on their severity. Moderated risk. This level of risk is primarily associated with age, especially in the individuals over 50 years old, where the incidence of colon cancer increases significantly. High risk. People with a history of adenoma, meaning precancerous lesions or colorectal cancers, are at greater risk. Chronic inflammatory bowel disease also increases susceptibility. A very high risk in certain genetic predispositions, which can significantly increase the risk of colon cancer, such as Lynch syndrome and familial adenomatous polyposis, which is a rare genetic disorder characterized by the development of multiple polyps in the colon. Finally, there is some exogenous risk factors related to lifestyle and diet. A diet high in animal proteins and excessive alcohol consumption is associated with an increased risk. Obesity and smoking are also aggravating factors. Certain ailments can help reduce the risk of developing colon cancer, which are called protective factors. A fiber-rich diet, including vegetables and whole grains, promotes colon health. Regular physical activity helps regulate metabolism and reduce the risk related to inflammation and obesity. Aspirin and low doses and under medical supervision may have a protective effect. Finally, hormone replacement therapy, when used for more than 10 years in postmenopausal women, appears to be associated with a reduced risk for colon cancer, although this benefit must be weighed against the other risks of this treatment. We will talk about the positive diagnosis, treatment, and other stuff in the next video. Thank you so much for watching until the end, and I'll see you in the next one.